What are the signs that indicate that it's time to see a cardiologist? If you or someone you know is experiencing any of the following signs or symptoms, it may be time to see a cardiologist for an evaluation. 1. Chest pain or discomfort. If you are experiencing chest pain, pressure, tightness, or discomfort, it could be a sign of a heart problem. Cardiologists are experts in diagnosing and treating conditions like angina and heart attacks. 2. Shortness of breath. If you find yourself frequently out of breath or struggling to breathe, especially with exertion or at rest, it may be indicative of heart or lung issues. Cardiologists can help determine the cause and appropriate treatment. 3. Palpitations. If you notice irregular heartbeats, fluttering sensations in your chest, or a racing heart that occurs frequently, you should seek evaluation by a cardiologist. These symptoms may be related to arrhythmias or other heart rhythm disorders. 4. High blood pressure. If you have consistently high blood pressure, hypertension, it's important to see a cardiologist for monitoring and management. High blood pressure can increase the risk of heart disease and stroke. 5. Swelling in the legs, ankles, or feet. Unexplained swelling in the lower extremities may be a sign of heart failure or other vascular issues. Cardiologists can evaluate the cause and recommend appropriate treatment. 6. Fatigue. Persistent and unexplained fatigue, especially if it's accompanied by other symptoms like shortness of breath or chest pain, should be evaluated by a cardiologist. Fatigue can be a sign of heart-related issues. 7. Dizziness or fainting. Frequent dizziness, lightheadedness, or fainting spells may be related to arrhythmias or other cardiac problems. Cardiologists can perform tests to diagnose and manage these conditions. 8. Family history. If you have a family history of heart disease or if close relatives have had heart attacks, strokes, or other cardiovascular conditions at a young age, it's a good idea to consult a cardiologist for a thorough evaluation and risk assessment. 9. Risk factors. If you have multiple risk factors for heart disease, such as smoking, diabetes, obesity, high cholesterol, or a sedentary lifestyle, it's important to see a cardiologist for preventive care and guidance on managing these risk factors. 10. Prior heart conditions. If you have previously been diagnosed with heart disease or have undergone heart procedures, regular follow-up with a cardiologist is essential to monitor your heart health and adjust treatment as needed. 11. Leg pain or claudication. Pain or cramping in the legs, especially during physical activity, could be a symptom of peripheral artery disease, PAD, a condition affecting blood flow in the limbs. Cardiologists can diagnose and manage PAD. Cyanosis, blue or gray skin. If your skin or lips develop a bluish or grayish tint, it may indicate a lack of oxygen in the blood, which could be related to heart or lung problems. This should be evaluated promptly. If you are experiencing any of these signs or symptoms, it's important not to ignore them. Consult with a healthcare provider, who may refer you to a cardiologist for further evaluation and appropriate treatment. Early detection and intervention can significantly improve outcomes in many cardiovascular conditions. What kind of tests does a cardiologist do? Cardiologists use a variety of tests and diagnostic procedures to assess heart health, diagnose heart conditions, and develop appropriate treatment plans. The choice of tests depends on the patient's symptoms, medical history, and the suspected heart problem. Here are some common tests and procedures that a cardiologist may perform. 1. Electrocardiogram, ECG or EKG. This test records the electrical activity of the heart to detect irregular heart rhythms, signs of previous heart attacks, and other abnormalities. 2. Echocardiogram. An echocardiogram uses sound waves, ultrasound, to create images of the heart's structure and function. It can help diagnose conditions like heart valve problems, heart muscle disorders, and congenital heart defects. 3. Stress test. A stress test, often done on a treadmill or with medication, measures how the heart responds to physical activity. It's used to detect coronary artery disease and assess exercise tolerance. 4. Holter monitor. A Holter monitor is a portable device that continuously records the heart's electrical activity over 24 to 48 hours or longer. It's useful for diagnosing intermittent arrhythmias. 5. Event monitor. Similar to a Holter monitor, an event monitor is a portable device that patients wear for a more extended period. It is activated by the patient when they experience symptoms, allowing for recording during specific events. 6. Cardiac catheterization. During cardiac catheterization, a thin tube, catheter, is inserted into the heart through a blood vessel. This procedure can help diagnose and treat various heart conditions, including blocked arteries and structural defects. 7. Coronary angiography. This procedure is often performed during cardiac catheterization to visualize the coronary arteries and identify blockages or narrowing. It may be followed by angioplasty and stent placement to open blocked arteries. 8. Cardiac MRI. A cardiac MRI provides detailed images of the heart's structure and function. It is used to evaluate heart muscle, blood vessels, and heart valves and can aid in diagnosing a wide range of heart conditions. 9. CT coronary angiography. This imaging test uses computed tomography (CT) technology to create detailed images of the coronary arteries, helping to detect and assess coronary artery disease. 10. Transesophageal echocardiogram (TEE). In a T, a specialized ultrasound probe is passed down the throat and into the esophagus to obtain detailed images of the heart structures, particularly the heart valves. 11. Nuclear stress test. This stress test involves the injection of a radioactive tracer to visualize blood flow to the heart muscle. It can help identify areas with reduced blood flow and assess cardiac function during exercise or medication-induced stress. 12. Cardiac blood tests. Blood tests can provide information about cardiac biomarkers, cholesterol levels, and other markers of heart health. These tests can help diagnose heart attacks, heart failure, and other heart conditions. 13. Electrophysiology studies, EPS. EPS is a specialized procedure that evaluates the heart's electrical system and is used to diagnose and treat certain arrhythmias. It involves the placement of catheters in the heart to stimulate and record electrical signals. These are some of the key tests and procedures that cardiologists use to assess heart health and diagnose cardiovascular conditions. The choice of tests depends on the individual patient's needs and clinical presentation. Cardiologists use the results of these tests to make accurate diagnoses and develop personalized treatment plans. What are the subspecialties in cardiology? Cardiology is a specialized field of medicine with several subspecialties, each focusing on specific aspects of heart and vascular health. These subspecialties allow cardiologists to develop expertise in particular areas of cardiovascular medicine. Here are some of the main subspecialties in cardiology. 1. Interventional cardiology. Interventional cardiologists perform minimally invasive procedures to diagnose and treat heart conditions. They often use catheters and specialized instruments to perform procedures like angioplasty, stent placement, and coronary artery interventions to open blocked or narrowed arteries. 2. Electrophysiology. Electrophysiologists specialize in diagnosing and treating heart rhythm disorders, arrhythmias. They perform procedures like cardiac ablation to correct irregular heart rhythms, and may implant pacemakers or defibrillators to manage certain arrhythmias. 3. Heart failure and transplant cardiology. These cardiologists focus on managing heart failure and may be involved in heart transplant programs. They help patients with advanced heart disease, including those who may need heart transplantation. 4. Non-invasive cardiology. Non-invasive cardiologists primarily use imaging techniques such as echocardiography, stress tests, and cardiac MRI to diagnose and assess heart conditions. They may also provide general cardiology care. 5. Preventive cardiology. Preventive cardiologists specialize in helping patients reduce their risk of heart disease through lifestyle modifications, risk assessment, and the management of risk factors such as high blood pressure, high cholesterol, and diabetes. 6. Congenital heart disease. Pediatric cardiologists focus on diagnosing and treating heart conditions in children, including congenital heart defects present from birth. Adult congenital heart disease specialists care for adults with congenital heart conditions. 7. Valvular heart disease. These cardiologists specialize in the diagnosis and management of heart valve disorders, including aortic stenosis, mitral regurgitation, and other valvular conditions. 8. Vascular medicine. Vascular medicine specialists focus on diagnosing and managing conditions that affect the blood vessels, including peripheral artery disease, PAD, venous diseases, and aortic diseases. 9. Cardiac imaging. Cardiologists with expertise in cardiac imaging use advanced techniques such as echocardiography, cardiac CT scans, and cardiac MRI to obtain detailed images of the heart and blood vessels. 10. Heart attack and acute coronary syndromes. These specialists are trained to provide rapid diagnosis and treatment to patients experiencing heart attacks and acute coronary syndromes, which are life-threatening emergencies. 11. Hypertension, high blood pressure. Hypertension specialists focus on the diagnosis and management of high blood pressure and related cardiovascular risks. 12. Sports cardiology. Sports cardiologists specialize in assessing the cardiovascular health of athletes and providing guidance on exercise and sports participation for individuals with heart conditions. What are the types of cardiologists as per their specialization? Cardiologists can specialize in various areas within the field of cardiology based on their clinical interests and additional training. Here are some types of cardiologists as per their specialization. 1. Interventional cardiologist. These cardiologists specialize in performing minimally invasive procedures to diagnose and treat heart conditions. They often use catheters and specialized instruments for procedures such as angioplasty, stent placement, and coronary artery interventions to open blocked or narrowed arteries. 2. Electrophysiologist. Electrophysiologists focus on diagnosing and treating heart rhythm disorders, arrhythmias. They perform procedures like cardiac ablation to correct irregular heart rhythms and may implant pacemakers or defibrillators to manage certain arrhythmias. 3. Heart failure and transplant cardiologist. These cardiologists specialize in managing heart failure and may be involved in heart transplant programs. They care for patients with advanced heart disease, including those who may require heart transplantation or ventricular assist devices, VADs. 4. Non-invasive cardiologist. Non-invasive cardiologists primarily use imaging techniques such as echocardiography, stress tests, and cardiac MRI to diagnose and assess heart conditions. They may also provide general cardiology care and are often the first point of contact for patients with heart concerns. Preventive cardiologist. Preventive cardiologists specialize in helping patients reduce their risk of heart disease through lifestyle modifications, risk assessment, and the management of risk factors such as high blood pressure, high cholesterol, and diabetes. 5. Congenital heart disease specialist. Pediatric cardiologists focus on diagnosing and treating heart conditions in children, including congenital heart defects present from birth. Adult congenital heart disease specialists care for adults with congenital heart conditions. 6. Valvular heart disease specialist. These cardiologists specialize in the diagnosis and management of heart valve disorders, including aortic stenosis, mitral regurgitation, and other valvular conditions. They may perform valve repair or replacement procedures. 7. Vascular medicine specialist. Vascular medicine specialists focus on diagnosing and managing conditions that affect the blood vessels, including peripheral artery disease, PAD, venous diseases, and aortic diseases. 8. Cardiac imaging specialist. Cardiologists with expertise in cardiac imaging use advanced techniques such as echocardiography, cardiac CT scans, and cardiac MRI to obtain detailed images of the heart and blood vessels, aiding in diagnosis and treatment planning. 9. Heart attack and acute coronary syndrome specialist. These specialists are trained to provide rapid diagnosis and treatment to patients experiencing heart attacks and acute coronary syndromes, which are life-threatening emergencies. 10. Hypertension specialist. Hypertension specialists focus on the diagnosis and management of high blood pressure and related cardiovascular risks. They work to control blood pressure and reduce the risk of heart disease and stroke. 11. Sports cardiologist. Sports cardiologists specialize in assessing the cardiovascular health of athletes and providing guidance on exercise and sports participation, especially for individuals with heart conditions or those at risk for heart-related issues. These various types of cardiologists collaborate to offer comprehensive care to patients with diverse cardiovascular conditions, ensuring that patients receive the specialized expertise required for their specific medical needs.